Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Chairman of the Presidential Task Force on COVID-19 warns against the production of substandard medical products. Bauchi State Commissioner for Education seeks support of the federal government to put in place adequate facilities to enhance safety measures for schools in the state. And as the search for the coronavirus vaccine intensifies, International Group of Security Services warns that some hackers are targeting organizations trying to develop COVID-19 vaccines. Nigeria has conducted over 200,000 tests till date, according to the Nigeria Center for Disease Control NCDC Situation Report 138. It puts the figures at 202,097 tests. The center also reports that in 31 states, 53 laboratories have been completed, including GeneXpert labs. In the meantime, the country recorded 643 confirmed cases in the last 24 hours from 18 states and the Federal Capital Territory, with Lagos having 230 of the cases, followed by Oyo, the FCT, Edo, Osun, Ebonyi, Rivers 30, Kaduna 28, Ogun 27, several other states as well, Enugu, Imo, Delta, Kano, Nasarawa, Ekiti, and Kebbi State. Now, 207 persons were discharged yesterday in 12 states, and those states you can see on your screen. Edo recorded the highest discharge in 24 hours, talking about 60 patients that recovered, followed by Gombe 30, Ebonyi 24, Kaduna 20, and the others there up until 2 in Delta. However, 6 deaths were recorded in 5 states. 2 deaths was recorded in Ebonyi, 1 each in Delta, Imo, Osun, and River State. At the Presidential Task Force briefing on COVID-19 today in Abuja, the chairman and secretary to the government of the Federation, Mr. Boss Mustafa, urged Nigerians to shun acts that indeed can aid the spread of the virus. And he says people should continue to comply with the non-pharmaceutical measures. Mr. Mustafa gave an advisory to the public to procure alcohol-based hand sanitizers from accredited sources. He called for a change in behavior and emphasized that the reasons for extending phase 2 of the East lockdown are still present.
As part of the non-pharmaceutical measures, we recommended, in line with global practice, the use of hand sanitizers. Ordinarily, that ought to stimulate local production because of increased demand. However, we regret to inform you that following a survey conducted by the Nigeria Institute for Pharmaceutical Research and Development, NIPRID, to check the influx of substandard goods into the market, it was revealed that 63% of alcohol-based sanitizers in Abuja do not have NAFDAC registration numbers. There could also be similar situations around the country. The Honorable Minister of Health has consequently issued an advisory to the general public to procure their sanitizers and other pharmaceutical products from credible sources. The Presidential Task Force equally appeals to the patriotic spirit of Nigerians and requests that they should desist from manufacturing substandard goods which could further endanger our unsuspecting Nigerians who innocently purchase them. Ladies and gentlemen, now is the time to turn adversity into victory by growing our entrepreneurial skills and industry base.
For the Minister of Health, Dr. Osage Hanire, his brief centered on the importance of wearing the face mask and other non-pharmaceutical measures. Dr. Hanire explained that its effective usage is necessary in reducing the risks of COVID-19 infection.
Studies in many countries have confirmed the effectiveness of wearing masks in reducing the risk of COVID transmission, since it provides mutual protection to all wearers. It is therefore still important for us not to give up, but to continue to practice these measures, especially the use of face masks, physical distancing, and imbibing the social etiquettes like not sneezing or coughing into open space, but into a tissue, especially where people are around you. Countries around the world, including even the most liberal in Europe, are now making masks mandatory for people who use public transportation and even those going outdoors. And they are imposing a fine for non-compliance. We urge all shops, businesses, service centers, and places authorized to open to the public to require that their customers and visitors use masks or a face covering, or else be denied entry if they do not adhere to these simple measures.
In the meantime, the COVID-19 pandemic may have led schools across the country to adopt desperate measures to cope with the learning challenges due to the closure of schools. In a number of states, teachers are now learning, or rather leaning, towards the use of technology and digital platforms to bridge the academic gap. In other states, like in Kwara, the leadership of the Trade Union Congress says not allowing the students sit for the examinations could spell doom for the education sector in the country. In a calm atmosphere, the classroom blocks of Capital City Secondary School, Oka, in Anambra State, sits idle after the federal government's directive. The schools remain closed to curtail the spread of the COVID-19 pandemic. It is perhaps a different experience for the teachers who have been asked to resume. They're now available to conduct the regular morning assemblies.
I pray that the Lord continue to strengthen us.
The state government is supporting the efforts of the teachers to utilize technology in providing remote learning opportunities for students through the state's radio service.
Okay, students, I hope you're following me.
Yes, it's not a typical classroom situation, but at least they are getting education via the Anambra Teaching, and we've had the commendations about that initiative.
Totally impressed with the quality of teachers in my state. These are teachers who were able to immediately adapt to the teaching on air. They took the bull by the horn and they came out to teach the students.
In Ilori, the leadership of the Trade Union Congress are backing the clamour for the reopening of schools.
I am in support of the suggestion the House of Representatives urging the federal government of Nigeria to rescind its decision and reopen schools, especially the final year SS3, GS3, and primary school final year students should be reopened. Else, the one year no school will spell doom for this country's educational system.
This is the view of classrooms and halls at the government's model school in Makurdi after months of being shut down. However, the management of the school says arrangements are in place for students to participate in the WAEC examination this year.
At the school level, we have about 120 students who are ready to sit for the exams. Should the federal government permit us to go ahead and do it, we have the capacity of spacing maybe 10 or even 5 per class to do.
Although the COVID-19 pandemic may have altered the norm in the educational system in the country, the health and safety of students will have to be the top priority of schools should the students return to the classrooms. We have Dr. Ajoke Adewale, a public health physician. She joins us via Skype from Lagos. It's solo, I believe. Thank you for joining us on the program.
Thank you for having me.
All right, Dr. Adewale, today the Presidential Task Force identified another threat to the pandemic fight. They were talking about fake hand sanitizers. How do we address this new challenge?
Yeah, so this is expected. When you have a pandemic of this proportion, the things that are going to be utilized in its prevention or treatment, you expect that bad people try to push fake products, and that even these products are hiked. Their prices are hiked, and even the quality is being compromised on. The way forward is, first and foremost, is for the government to take charge of the situation, to make sure that not everybody is, producing hand sanitizers in their home and using it. There are guidelines to the production of sanitizers. For instance, you start with education. Everybody should know that whatever sanitizer you buy must be approved by NAFDAC. And not only that, it should have a high level of alcohol. So if your sanitizer, if you look at the contents of your sanitizer, and it has less than 60% of the two common alcohol being used in sanitizer are ethanol and isopropanol. So if it's ethanol, it should be 60%. If it's isopropanol, it should be 70%. But you can just use 70% as your guideline. If you know that the alcohol content of your sanitizer is less than 70%, then you shouldn't be using it. And it's also good to double check that this is certified by NAFDAC or the SON to make sure that you're using a product that is original. Also, I know that in institutions, the pharmaceutical departments, they are taking charge by producing these things for the institutions. So this reduces people purchasing fake products. So when you're in an institution that is clinical, the pharmacists and those in the related departments can actually make it according to WHO standard, because WHO standard says at least 60% ethanol and at least 70% isopropanol. It's just quite clear. We need to increase the awareness about sanitizers, how to use it, and the right type to buy, to make sure that people buy the ones that are approved. We also need to make sure that we take charge of the market. I appreciate what the PTF, the conference they gave. They talked about approval and how will I say, monitoring the market, making sure that there are stops and finishes to people that try to market the wrong products and take advantage of this pandemic.
But also, some people have talked about if indeed government and its agencies have been on top of standards of perhaps other products, and this is before COVID-19. So what is the assurance that indeed they will stay on top of this to prevent the fake products as the time that we're fighting this pandemic?
I see a lot of effort and commitment. And even if this wasn't given the adequate attention before, now let's assume that it wasn't. This is a pandemic of unprecedented proportion, and prevention is at least a bit straightforward. Protect yourself, wash your hands, and if we are the ones giving awareness to these people, we should be able to enforce and put in place checks. So I believe that even if this wasn't optimally done before COVID-19, all efforts will be put in place to make sure that people are using the right sanitizers. It starts from the pharmaceutical industries. The same way they are going about closing down places that do not that aggregate people more than 20 or more than the said number of people in a place. It's the same way they can make sure they lock down pharmacies or people that are marketing sanitizers that are not up to standard. Quite frankly, so much attention wasn't given to this before. But now that we've noticed that there are problems concerning this, I think that it's a collective responsibility of not just the citizens, but the government, of pharmacists, of health workers, of manufacturing companies to make sure they do things the right way. I don't think that there'll be any problem in validating sanitizers once the government can establish that the right amount of alcohol and the right amount of ingredients are in the hand sanitizers. Hand sanitizers should be safe. Just because we are trying to protect pandemics do not mean that we should use things that are toxic to the body or toxic to the skin. Does not mean that, we just market anything in the name of hand sanitizers. No, they should be safe, they should be effective, they should be potent after use, and that is what the regulatory bodies, I trust they will enforce during this period.
And they should be used with the other non-pharmaceutical measures. Thank you so much, Dr. Ajoke Adewale, public health physician. Thank you for joining us.
It's my pleasure.
Still to come on the COVID-19 updates, more about the zoonotic source of the virus. Stay with us. Welcome back. It's more on schools and resumption. Here's our correspondent in Bauchi State, Hajara Aliyu, with more.
Bauchi State Commissioner of Education has been speaking about the peculiar challenge of the state pertaining to reopening of schools. Although he was quick to maintain that the state still aligns with the federal government in whatever decision that is taken.
Over the years, we have been very recreative, and in a way that our population is outgrowing our economy. So we didn't have the resources to build more classrooms. In the end, even under the federal government colleges, you may find a class with maybe 90 children.
Speaking about limited resources, the Commissioner of Education is of the opinion that adequate funding for education will solve some of the problems. He is advocating for financial support from the federal government in order to ensure that safety protocols are put in place before schools are reopened. This is what he had to say.
And we hope that the federal government should look for a loan. Maybe it has taken a loan from the World Bank on BESDA and on many other things. I think it should take a loan also for education on COVID-19. This is essential so that at least we will be able to reasonably meet some of these conditions and then reopen. Maybe it can give us the money as a grant or maybe as a soft loan or something like that, and we will take it and ensure that we have opened as soon as possible. But in the absence of money, those conditions can hardly be met.
Private schools in the states are yet to speak about where they stand with regards to reopening of schools, but we understand that the Ministry of Education has to grant them permission before they reopen. From Bauchi State, Hajara Aliyu for COVID-19 updates.
Now, the initial origin story told by health officials in Wuhan during the first few weeks of January on COVID-19 was that a cluster of people connected to a seafood market developed an unusual pneumonia and that the outbreak stopped after the market was closed and disinfected. But confusion about the origin of the virus identified in Wuhan patients arose when researchers published the first epidemiologic studies of the city's outbreak, and 4 of the first 5 cases confirmed to have the virus had no link to the market. Mr. Alaba Ovie is a histoscientist, a medical histopathology department, University of Abuja Teaching Hospital. He joins us from Abuja studios. Thank you for joining us. I'd like to begin by asking what you think the WHO is likely to find in its investigations on the virus origin in Wuhan.
Good evening, Millicent. Good evening, Nigeria. They are going to find something. And what is it? What they have in mind, they want to go and find, they will find it. I don't want to go into the international politics that involve that, but I know science does not operate on speculation. Science operates on fact, and we have tools that can guide our decision in what we are looking out for. For instance, simple artificial intelligence is going to help out. And of course, it was an expert epidemiologist, AI, artificial intelligence epidemiologist that first flagged off the issue of COVID-19 in China. So that's a very good tool. Artificial intelligence can solve that. Then secondly, tools like bioinformatics using simple software like BLAST to look at degree of relatedness can be employed. And also next generation sequencing can be employed. We will find out the origin, whether it's actually from China in the first place or it was imported into China and then China became the victim of that virus. I don't believe in cover-up. I also encourage the global community to look into that with the mind of finding the origin and solution. But of utmost importance presently is, how do we end COVID-19? How do we end this coronavirus so that our school should be open, so that our market should be open, so that our street will be returned, so that our churches, our mosques, so that people can go back to their normal life. This life is no longer funny with many people. So attempt to end it is of most important than finding out the origin. It has happened, okay? So what we need now is to solve the quagmire the global community have found themselves, and that will suffice it. But what they set out to find out, they will look at, they will find it. If they want to indict China, they will find reason. If they want to solve it, they will find reason. But we have scientific tools available to all the scientists to solve that problem.
Mr. Ovie, I want you to quickly tell us, and this is coming to Nigeria, the head risk communication of the NCDC says that states need to do more to create demand for testing. You talked about the supply and then the demand angle, but, you know, are states really taking ownership of the pandemic fight? In just a few seconds, if you can.
Yes, thank you so much. I think one of the way out of this pandemic is this just question that you have asked. The state, not just the state and local government, I am of the opinion that the ownership of this fight should be taken back to the people. Identify people of influence, identify people that the society respects so much. For instance, in this part, in Northwest or in Northeast, get the malams, educate them, let them understand the trouble that is with us. By the time that they understand, engage them to reach out to their subject. Engage the emirs to reach out to their subject. You will see the wonder that we identify possible cases that should be tested. Secondly, why don't you identify pastors that have so much influence? By the time that they understand and they buy into fighting this pandemic, you will see the wonder. So the ownership shouldn't just be by people don't trust government to some extent now. People believe that the whole thing is a scam. So why don't you engage people that such people believe in? And the game will change. So I am of the opinion that in as much as local government, state should show responsibility, show leadership by stepping in, I also believe that they should also engage people of influence.
All right, Mr. Ovie.
Influence, people that society will listen to them. Let them champion this.
We'd like to thank you, Ms. Alaba Ovie, histoscientist, medical histopathology department, University of Abuja. Thank you for joining us on the program.
Thank you, Millicent.
And from the global scene, Russia says it has nothing to do with earlier reports of attempts to hack information relating to COVID-19 vaccine development. Russia is reacting to a claim by the UK's National Cybersecurity Centre, which says Russian hackers are targeting organizations trying to develop a coronavirus vaccine in the UK, the US, and in Canada. In the meantime, Spain is today remembering those who have died from the coronavirus pandemic with a tribute to more than 28,000 lives lost. The UK is also holding a memorial, encouraging people to upload names of loved ones online. Our website, channelstv.com, has the latest news. All you need to do is log on at channelstv.com. You find the latest stories coming in there from Nigeria, Africa, the rest of the world. You can see that picture, France making public face mask wearing mandatory indoors. Quite different. So many countries taking different non-pharmaceutical measures to making sure that the virus stays at bay. Log on, and that is channelstv.com for the latest news. That's the COVID-19 update. Thank you for watching. I'm Millicent Nwaka. Stay healthy, stay safe.